If you're watching this video, it's likely that you're struggling with wrist pain. You might have tried a lot of things to try and offload it, and no matter how much you stretch it, you can't seem to get it working. So today we're going to go through some rehab principles for different stages of wrist rehab and finding out like which bit you need to do depending on your pain, your swelling, and your stiffness, so on and so forth. Again, this does not replace medical advice. This is just generic exercise guidelines when it comes to rehabilitation. So, before we start giving you the exercises, I'm going to show you two things that you might have seen before, especially if you are definitely seen it if you've like seen gymnastics doing tumblings, and because they use it all the time. So, can you get the tools out? With wrist, if we're to simplify it in like simple terms, there can be two main problems. Either your wrist is too weak to withstand the load, which causes issues with pain, or maybe you've been overloading it and there's some inflammation that's happening, so you get a bit of swelling, and you've been getting kind of impingement-like syndrome, or you can have like a limited mobility that's causing symptoms. Actually, I said two things, but one more thing, less kind of common to see, but if you're quite mobile, hypermobile people with really bendy bones and couple bones, and there's 8 of them, then that is a slightly different treatment approach. But what I'm going to show you is 2 different things that might be helpful, that you can kind of test it out as yourself. So if you've been told that you've got a bit of swelling, a bit of impinging of the wrist, the TFCC type injury, this is what you need. So you can see there's a list of space here. This does not replace rehab, can I just say, but it will help you to feel more loose in the joints. So what I do before I apply, often I just test it, so I just have your hands on the wall and just feeling like where's the pain and stiffness is, just having a feel. And I mean, Sam doesn't have pain at the moment, but it's really, really easy. Essentially, there's a bit of a spacer that allows the swelling to happen, and this acts as a bit of support structure. So you just put through the hoop.
It's a lot easier when someone does it for you as well.
Yes. And also when your hands are on the table, rather than like in the mid-air, whole shoulder. The main thing is making sure there's space in this bone area here, and then you just tighten it. And I have a few gymnasts that uses it and really helps them to go through when they are struggling with, they really want to like keep training, but they just need a bit more, a bit of a splint to elevate some of that pain. Can you try again? Just to make sure it's not catching. So if you are the other way, where you know that your wrist is not very strong, and this might be what you need, so this is a bit of sort of taping. Wrist taping is very, very easy. Essentially, one of the tests that you can do, can you have your hands on, normally I do it on the floor, but for this video we'll show you this. And then you bring it a bit lower, and then can you push your weight through the wrist? And for example, if he's like, ooh, doesn't feel great. And then if I apply a squeeze, and then come down. And then suddenly it feels a bit better. So it's telling me maybe there's a little bit of instability there that could do with a bit of support. So then this is just single oxide tape, sport tape. Nice and solid, use it once and then you can get rid of it. I'm not sure how strong my tearing skills it. Let's get some scissors. Can you hold it for me?
Yeah.
Can you use your other wrist? So basically, just wrap it around tight. Oh, sorry about the hair.
That's alright.
So if you have hair, you can add some, sometimes I just put some oil when you take it out. A bit tighter, and then you have a feel again. And you can try it with handstands to make sure it just doesn't like dig into the wrist. Yeah. Probably see a lot in aerial as well.
Yeah, we do.
Yeah. Awesome. So do you want to keep these on? So while you have
So I'm nice and supported.
Right, so we're going to go through different stages of rehab. So the first stage is basically like trying to get range of motion, but not loading it too much. So can you have this ball and push it against the wall? And you're going to slide your wrist down and up. So then you're adding a bit of a stretch in the wrist. And you can do the same, but opposite, like a prayer pose. I quite like Pilates ball. It's just a bit more gentle to the body, a bit more softer. And then you can control the movement more. And you can do different directions too. Awesome. The other thing that will be quite helpful with wrist is practicing dumbbell stuff. So we have a light dumbbell. essentially is practicing coming up and then coming down. And you can do the same in hammer as well. Oh, the other way, yes. Or you can try the same in hammer as well. Sometimes people are a bit weaker on the coming down. It's a hard one to train, the ulnar deviation. Yeah. So these are some strengthening exercises you can try. And then if you are actually getting really better, you want to progress with more advanced loading stuff, I always try and progress it. So the first thing I'll try is like 4-point kneeling first. The camera might not
That's
be
not
able
going
to
to pick
see.
it up. Yeah.
The 4-point kneeling essentially is having your hands and knees on the floor. But for demonstration purposes, we can't do it. Can we do it? No.
Not really.
Okay, cut out the video. So we do the harder progression. So you can do 4-point kneeling, but this time you're gonna have your feet walking up the wall. Keep pushing it down. So the 4-point kneeling essentially is where Sam is right now on the floor. But to increase the load, you have to walk up the wall. Or you can go into things like downward dog, and then you can kind of up the load that way as well. And then Sam's going to go into a handstand.
No, he's not.
Maybe not today, we haven't warmed up fully. Yes, so these are the things that you can try. And the last thing that I'm going to add, with anything, if you have issues with your wrist, try and strengthen your shoulder. If your shoulder is more stable, it's going to deload the wrist, which reduces the problem that you get on the